As South Africa marks National Pregnancy Week from the 3rd to the 7th of February, mental health experts are raising concern about the silent burden of depression and anxiety during pregnancy. The South African Society of Psychiatrists is urging expectant mothers not to discontinue psychiatric medication without professional guidance. And for more on this, we are now joined by Dr Ronell Williams, a member of the South African Society of Psychiatrists, to unpack the risks, the realities and the support available to pregnant women. Dr Ronell, thank you so much for your time this evening here in SABC News. Something very important that you are highlighting there, and that comes to mental health during a very crucial and important time, and that is during pregnancy. Why is it so important to attend to these issues during pregnancy?
Good evening, and thank you so much for having me. I think the importance we're trying to highlight here is that, untreated depression or anxiety during pregnancy can have long-term consequences. And that can be for the mother, the baby, the family, as well as the society at large. And that these symptoms are quite common, but they're treatable, and we can prevent these negative outcomes in the long run.
And maybe take us through some of these symptoms in which you speak of. How do you know during pregnancy if you are facing depression or anxiety?
So the challenge is that a lot of women are told that some of the symptoms they're experiencing is due to the hormonal changes.
Yeah.
And we accept a lot of hormonal changes happen, physical changes, life changes with the acceptance of a pregnancy. But what we are trying to emphasize is that if there is persistence of these symptoms, as well as the severity getting worse, so they're worsening over time and impacting your ability to function on a day-to-day, to take care of yourself, that requires some assistance, and that might either be speaking to your general practitioner, your midwife, or a mental health professional. And the start for most women might be their obstetrician, to just discuss if this is normal or this is something that's actually experienced by somebody who might be depressed or anxious.
Why do some women experience, symptoms of depression and anxiety during pregnancy?
There could be several reasons. The most common one that we know of is that women can suffer from depression prior to pregnancy. And if you have a past history of mental illness, especially depression or anxiety, there's a higher risk during pregnancy. And the common numbers is 1 out of 5 people can suffer from a mental illness. Now, with the pregnancy, obviously, there's a lot of stresses that's associated with this. And we are living in South Africa with a lot of socioeconomic stresses and other work-related family dynamics with poor support that can contribute to them having a higher risk of developing either depressive symptoms or anxiety symptoms during pregnancy.
How do we treat, when it comes to depression during pregnancy and anxiety, and when it comes to the antidepressants which are prescribed to some women, are they safe to use during pregnancy?
Yes, current evidence actually shows us that most of the antidepressants, especially including the SSRIs. Now, most people will ask me, what are those? It's a certain group of antidepressants that is commonly prescribed, that they've been shown to be quite safe during pregnancy. But we say this as long as it is prescribed carefully and monitored throughout. So that's the importance that we need.
What are the common challenges which you have found as psychiatrists when it comes to some women identifying that they do indeed have a problem and they need to treat their mental health during their pregnancies?
I think the most common one is having to accept and then seeking assistance, because there's still such a stigma around seeking mental health advice from a psychiatrist or psychologist. And then secondly is that they fear if they take medication during pregnancy that it could cause harm to the baby. I mean, the most common thing we see during pregnancy is women that are on treatment or pregnant and they stop their medication immediately without medical assistance. So we warn against that. We usually do an individualized approach. So each woman is different, and we discuss what would be the benefit of being on treatment, and treatment could include medication, but as well as social support and psychotherapy or counseling. It depends on the severity of the symptoms that the person is experiencing. So it is about having that open discussion around should you be on treatment, medication-wise, or alternative treatment like therapy, or what is the risks if you
Yeah.
are not being treated? Because I've discussed those consequences, and they could be quite severe
Yeah.
in cases like harm to herself or even the baby. We
Yeah.
want to avoid all of that.
And I want us to deal with that. What are the ramifications? Should you be somebody who suffers from mental health challenges and you are on medication and you choose not to take it during your pregnancy? What are the ramifications on that?
Evidence has shown that untreated depression or anxiety, so if you stop your medication or you've never been started on treatment, that it has been shown to have higher evidence of preterm labor, so mom goes into birth early, as well as low birth weight of baby, poor development of the fetus while in the uterus of the mom, and development afterwards. It can also lead to difficulty bonding with the baby after birth. And then, of course, risk to mom is maternal self-harm, so mom's harming herself or even suicide. And the rare but quite severe ramification is harm or death to baby, as commonly referred to as infanticide.
All right. And before I let you go, Dr. Williams, what is your advice to women who do identify with some of the symptoms you have told us this evening?
The message I'd like to leave them with is that these symptoms of depression or anxiety is quite common, it's treatable, and it can be managed. It is not something that necessarily have to leave you or your baby and family with long-term consequences, and that there is support out there. Besides seeking help with either your GP, your midwife, or mental health provider, we also have SADC, South African Depression and Anxiety Group, with a lot of resources available on their website, as well as helplines where you can call in and get advice as to where to seek help. So the first thing I'd like to say is, if you're concerned, reach out and speak to someone, even if that means speaking to your spouse or partner or family member in order to make the first step to getting help.
Dr. Williams, thank you so much for your time and for that insight. That's Dr. Williams, or Dr. Ronell Williams there. She's a member of the South African Society of Psychiatrists. They're speaking to us about issues of mental health challenges, particularly to women who are facing pregnancy.